If you have diabetes, you have to be aware of diabetic ketoacidosis, which may mean the diabetes drugs from the diabetes drug companies aren't working. You may need new diabetes drugs off of the diabetes drug list to fix the problem before it's too late. The problem with diabetic ketoacidosis is that the body ends up producing extremely high levels of ketones. There isn't enough insulin in the body to move the glucose into the cells. The problem with not having enough insulin in the body is it starts breaking down fat as its alternate fuel. This triggers the production of toxic acids into the blood called ketones, which leads to diabetic ketoacidosis if it isn't treated. This problem could happen very quickly, sometimes in 24 hours. If you start experiencing frequent urination, excessive thirst, vomiting and nausea, loss of appetite, abdominal pain, fatigue, etc., then you need to see your doctor immediately. These symptoms can mimic the flu, which makes it difficult to diagnose if you didn't know you had diabetes. The best way to find out is to check ketone levels and blood sugar levels. If everything is consistently high, then you may need emergency care. This complication of diabetes is fatal and can be occurring because you didn't know you had diabetes, you have an illness, or you aren't responding to the diabetes drugs. You may be in need of new diabetes drugs. You may have missed a couple insulin treatments or the therapy isn't working correctly, which can also trigger an episode. If diabetic ketoacidosis does happen, treatment is usually electrolytes, fluids and insulin. Different tests will be taken to make sure it doesn't happen again, and the appropriate diabetes drugs will be prescribed. The goal is to make sure there's enough insulin in the body. Learn more at diabetes-drugs.org.